Every single morning, you might be committing a violent act against your manhood, and you do not even realize it. You sit down, you get comfortable, perhaps you pull out your phone to read the news, and you push. You think you are just relieving yourself. You think this is a harmless, necessary, daily ritual, but biologically speaking, you are creating a high-pressure hydraulic trap that is slowly strangling your prostate, cutting off healthy blood flow, and forcing toxic venous blood to pool exactly where you cannot afford it. If you are waking up 3 or 4 times a night to urinate, or if you feel like your bladder is never truly empty, you have probably been told it is just aging. You have been told your prostate is growing because of hormones. But what if I told you that 50% of your symptoms are not caused by growth, but by mechanical damage you are inflicting on yourself every single day? My name is Dr. Emily Carter. I am a board-certified urologist with 25 years of experience treating men who feel like their bodies are betraying them. I have seen thousands of patients who take all the right supplements. They eat the saw palmetto. They avoid spicy foods. Yet, they still suffer. Today, I am going to expose the silent, mechanical killer of prostate health that almost no other doctor talks about. I am going to teach you how to stop physically traumatizing your pelvic floor, and I will give you a specific, science-backed protocol to reverse the damage starting tomorrow morning. Let me tell you about a patient of mine named Arthur. When Arthur walked into my clinic, he was 64 years old, a retired structural engineer. Arthur was a meticulous man. He had a spreadsheet for everything. He tracked his diet, he walked 5 miles a week, and he took every prostate supplement sold on the internet. Yet, Arthur looked exhausted. He told me he was getting up 5 times every night. His stream was weak, hesitant, and painful. He was terrified that he needed surgery. When I examined him, his prostate was enlarged, yes, but it was also boggy and tender, which is a sign of severe congestion. I asked Arthur a question he did not expect. I asked, "Arthur, how long do you spend on the toilet every morning?" He looked confused and said, "Well, Dr. Carter, that is my quiet time. I read the paper. I answer emails. I suppose I am there for 20 or 25 minutes. That was the smoking gun. Arthur was not just suffering from hormonal aging. Arthur was suffering from a condition caused by the modern toilet and the modern habit of distraction. He was inadvertently pressurizing his pelvic floor, causing his prostate to swell like a bruised ankle. To understand why this is happening to you, we have to look at the enemies. The first enemy is the sitting position itself. The modern toilet is designed for comfort, not for biology. When you sit at a 90-degree angle, your puborectalis muscle chokes your rectum. It creates a kink in the hose. This forces you to strain. This brings us to the second and most dangerous enemy, the Valsalva maneuver. This is the fancy medical term for straining and holding your breath to push. When you do this, you are skyrocketing the intra-abdominal pressure. Now, here is the secret anatomy lesson most urologists skip. Your prostate is surrounded by a dense network of veins called the periprostatic venous plexus, or Santorini's plexus. These veins lack the strong valves found in your legs. When you sit for 20 minutes and strain, you are forcing blood backward into these veins. You are creating varicose veins inside your pelvis, right around your prostate. This leads to hypoxia, which is a lack of oxygen. When the prostate is starved of oxygen due to this venous pooling, it reacts by getting inflamed. It creates scar tissue. It swells. So, while you think you are just reading the news, you are physically expanding the vascular tissue around your urethra, choking off your flow. The third enemy is time. Gravity is not your friend here. The longer you sit with your hips below your knees, or even level with them, the more blood pools in the pelvic floor. Arthur was doing this for 25 minutes a day. That is over 150 hours a year of direct, pressurized trauma to the prostate. So, how do we fix this? We do not need expensive medication. We need physics and biology. We need the heroes of this protocol. The first hero is the modification of geometry. We must unkink the hose. We do this by mimicking the squat. This relaxes the puborectalis muscle and straightens the rectal canal. The second hero is the biochemical softener. We need to ensure that you never, ever have to strain again. This requires specific hydration and specific minerals that draw water into the gut. The third hero is the breath. Most men push with their chest and throat tight. We need to engage the diaphragm to create a piston effect that gently moves waste without pressurizing the veins around the prostate. Here is your new Contrarian Protocol. You need to follow this exactly for the next 6 weeks to see the results Arthur saw. Step 1 is the morning fluid flush. The moment you wake up, before you look at your phone, before you have your coffee, you must drink 500 milliliters of warm water, not cold water. Warm water triggers the gastrocolic reflex. It signals your colon that it is time to empty. To this water, I want you to add 1/4 teaspoon of sea salt for electrolytes and squeeze half a lemon. This hydration ensures your blood is not sludge, helping circulation in that pelvic plexus. Step 2 is the magnesium loading. You need to take 400 milligrams of magnesium citrate or magnesium glycinate in the evening, about 1 hour before bed. I prefer magnesium citrate for this specific protocol because it pulls water into the intestines, making the stool soft and effortless to pass. If you are straining, you are failing. Step 3 is the mechanics. You must get a toilet stool. It needs to be about 7 to 9 inches high. When you sit on the toilet, put your feet up on this stool. Lean forward slightly. This mimics the ancestral squatting position. But here is the most important part, the 3-minute rule. You are no longer allowed to bring your phone, a book, or a newspaper into the bathroom. You go in when the urge is undeniable. You sit, you place your feet on the stool, and you get out. If it does not happen in 3 minutes, you stand up and leave. You do not sit there and wait. Step 4 is the vocalization technique. This sounds strange, but it works. When you need to bear down, do not hold your breath and clench your teeth. Instead, keep your mouth slightly open and make a low humming sound or a low hiss as you exhale. This engages the diaphragm and relaxes the pelvic floor muscles, preventing that dangerous spike in pressure around the prostate veins. Now, let us talk about synergy and sabotage. What enhances this? Walking. Walking activates the calf muscle pump, which helps return venous blood from the lower body back to the heart, reducing congestion in the pelvis. A 20-minute walk daily creates synergy with this protocol. What sabotages it? The biggest saboteur is postponing the urge. When you feel the need to go, and you hold it because you are busy or watching television, the water is reabsorbed from the stool, turning it into concrete. This guarantees you will strain later. The second saboteur is opioids or medications containing codeine, which paralyze the gut. If you must take pain medication, you must double your water intake. So, what happens when you start this? Let us go back to Arthur. In week 1, Arthur struggled. He missed his reading time. He felt awkward using the stool, but he noticed something. He was not pushing anymore. The magnesium and the water made the process effortless. By week 3, the constant feeling of pressure in his perineum, that heavy sensation like sitting on a golf ball, began to fade. This was because the venous pooling in Santorini's plexus was finally draining. Fresh, oxygenated blood was reaching the prostate tissue, allowing inflammation to subside. By week 6, the change was profound. Arthur told me, "Dr. Carter, I slept for 6 hours straight last night." His urinary stream was stronger not because the prostate shrank by 50%, but because the swelling and the congestion around the urethra had collapsed. He reclaimed his quality of life, not by adding a new pill, but by changing the mechanics of how he sat for 3 minutes a day. Here is my challenge to you. For the next 30 days, treat your bathroom habits as a medical prescription. Get the stool. Drink the warm water. Leave the phone in the other room. Stop the strain. It is a simple mechanical fix for a complex biological problem. Your prostate is under pressure, and you have the power to release it. Thank you for watching. Stay healthy.